Good morning, viewers, and welcome to the YouTube channel Dr. Rakha. I firmly believe that Bhagwad Gita is modern day handbook of counseling. In the recorded history, Lord Krishna was the most effective psychotherapist who could treat Arjuna and help him come out of dilemma in a very short span of time. In recent studies, it has come out that if people suffering from anxiety and depression read and implement Gita teachings, they recover faster and need fewer medicines. The procedure of counseling, as prescribed in Gita, is to begin the counseling. Lord Krishna motivated Arjuna by highlighting his strengths and praising his ancestor so that Arjuna regained his lost self confidence and self esteem. In chapter 3, Lord Krishna advocated the theory of karma and suggested that all human beings must develop the habit of doing the desired and designated duty without any prejudice and precondition. This advice worked well for Arjuna and is equally good for human beings of today. By following this advice, we can overcome dilemma, procrastination, uncertainty induced stress, and guilt feeling arising out of mound of unfinished tasks. If we keep doing our assigned work and duty, we are bound to develop expertise, earn respect from peers and superiors, and this certainly will help in regaining the lost self respect and self confidence. Then and there only concept of counseling. Actually, most effective counseling time and venue should be then and there only. As in case of Mahabharata, Lord Krishna counseled Arjuna then and there only. I believe we all should read Gita and believe in its philosophy, as you never know when and where you may find Arjuna to counsel and you can help at that time. Lord Krishna explained the spirituality in chapter 4 of Gita and the relationship between soul and supreme soul. This very aspect makes human beings feel elated when they realize their true status and immortal nature of the soul. This realization brings in the feeling that we all human beings are equal, and this reduces the emotions of hatred, jealousy, and seduction, which are cause of anxiety for most of the people. Lord Krishna in chapter 5 emphasized karma yoga. The philosophy of doing karma while renouncing their fruits is what can reduce expectation induced anxiety. The practice of dhyana yoga, as in chapter 6, is the realization of self through meditation. As you know, meditation is the single most important practice to fight depression and is being promoted globally nowadays. Lord Krishna in chapter 6 emphasized the knowledge of Absolute. Once we realize that God is the supreme truth, supreme cause, and supreme force of all things and actions, both material and spiritual, we shall surrender to Him and become free of tension, stress, and agony of all sorts. We all know that we are in partial control of our thoughts and actions, and there are several other factors in the universe which affect our lives and are not under our control. Some of the events happening in our lives have a quick impact, and others impact we realize at a later date. Therefore, instead of connecting our actions or others' actions to the good or bad outcomes in our life, we should leave the results to the supreme power. The method of devotional service, as in chapter 12, or Bhakti Yoga, make ordinary human beings great human beings. Pure devotion to duty and pure dedication to service will lead to lesser and lesser agony, envy, and jealousy, and then thereby enhance the levels of happiness, satisfaction, and love. That's what we want. The whole of Bhagavad Gita is a compilation of logical principles and clear directives which will certainly help people undergoing dilemma, confusion, and procrastination, as it has helped Arjuna just before the deadline of doing karma, the war. Gita is a model of counseling. Bhagavad Gita is almost entirely a dialogue between Lord Krishna, who is counselor, and Arjuna, who is the subject. Gita of 18 chapters and 701 shlokas begins with Arjuna Vishad Yoga, sorrow of Arjuna, and ends with moksha sannyas yoga. The complete transformation in Arjuna's thoughts was due to the process and content of the dialogue mentioned in great epic Gita. Gita has contemporary application to current day psychotherapists. When a confused Arjuna turned to Krishna for advice, Lord Krishna stated rational philosophical concepts that are relevant even today. Gita teachings, in fact, have answers to all our problems. It was considered a spiritual dictionary by Mahatma Gandhi and was a book of inspiration for many leaders of the independence movement. American psychiatrists are recommending reading of Bhagwad Gita to the patients of anxiety in the US. This news article shows a US based psychiatrist how he is promoting Bhagwad Gita as crisis oriented therapy. A Hungarian psychologist also is recommending the most effective counseling in one session. That too in the midst of battlefield lies between these two shlokas uttered by Arjuna. Chapter 2, Shloka 3, Arjuna says in despair, I am your disciple, guide me, help me. Chapter 18, Shloka 73, Arjuna enthusiastically says, clouds have cleared, my senses are back, all my doubts vanished, I am ready to act as you direct. And that's the power of dialogue of Gita. Counseling or psychotherapy is essential and an integral component of psychiatric interventions in the management of psychological distress that you all know. The eminent Indian psychiatrists and psychologists propose Bhagavad Gita as a source and model to develop psychotherapeutic concepts suitable to Indian context. Arjuna expresses sorrow, anxiety, fear, and guilt, leading to a state of inaction. After seeing his guru, cousins, uncles, nephews, friends, etc., all lined up in the enemy camp in the battlefield, winning the war and consequently the kingdom, that meant killing all these people whom Arjuna respected and loved. This is a sin of commission. Overwhelmed by the acute state of sadness and guilt, Arjuna drops his weapons and turns to Lord Krishna for help and guidance. I am your disciple, guide me, help me. The therapeutic background of this case study will be that Arjuna is the subject and Lord Krishna is the counselor. And it is a single session therapy conducted by Lord Krishna. There was no time limit prescribed for this counseling session. The counselor is subject's relative. The counselor stays with the subject throughout the crisis period, and the patient has immense belief in the therapist and considers him a friend, a philosopher, and guide, and that's really very important in psychotherapeutic counseling. Arjuna's physical or mental state can be described that he was having anxiety, as was evidenced by the weakness of limbs, dryness of mouth, and shivering of body. Gandivam slips from the hand, unable to stand, dizziness and confusion of mind or other symptoms the anxiety was showing. Arjuna had negative thoughts also. He says, neither desire for victory or kingdom, nor desire for pleasures and luxuries. He was having a guilt feeling as preparing for sinful act of killing his own kin was there. The probable diagnosis of Arjuna at that particular time was that he was having acute, transient, situational adjustment disorder with symptoms of anxiety with predominant guilt feeling. However, there is no past history in spite of major psychological stressors like humiliation at the time of Draupadi Chirharana. The personality of Arjuna can be described at that time like erratic coping pattern, proactive role in preparation of war, and he drove into the battlefield with great enthusiasm to fight and win, and then suddenly he is unable to cope and leaves the arms. The therapist, Lord Krishna, can be described as a long time friend, relative, well-wisher of the subject, highly respected in the community, a legendary mediating skills with tons of common sense. The therapeutic process which was used then and there was cognitive or rational emotive approach. The discussion was on the natural inevitability of the birth and death of life cycle, immorality of soul, performance of on dharma duty, or otherwise running the risk of shame and public defame that led to change of thought of Arjuna. The goal of therapy is removal of guilt and motivate for action. The action and renunciation was the one concept in Bhagwad Gita that received global attention is the emphasis on action. Without performance anxiety, without greed for the fruits, and without the choice of non-performance of duty. You have the right only on action, not on the fruits of your work. Emphasis on the power and capabilities of the individual. And the end, faith is the most important element in the therapeutics, not just in psychology, but in medical practice in general. We all should read Gita thoroughly to help the present day Arjunas. Thank you very much for watching this video. Please subscribe to this YouTube channel, Dr. Rakha. Like the videos, motivate me to make some more such videos. Thank you so much. Have a nice time.